The subcommittee will come to order. In accordance with Committee Rule 5E, I ask unanimous consent that Representative Kim from California be permitted to participate in today's subcommittee hearing. All right, so ordered. Hey, good afternoon. First, I want to thank all of you for joining us today, this field hearing for the Subcommittee on Economic Opportunity for Veterans on the House Veterans Affairs Committee. I want to thank the staff for setting everything up. We've got all the sound people that flew out here from D.C. and spending time away from your homes. I want to thank you for doing that. My name is Derek Van Orden, and not only is it my pleasure to serve as the congressman for the 3rd Congressional District, but also I have the honor to serve as the chairman of this subcommittee. This morning, we're at the United States Navy SEAL Team headquarters in Coronado, California, dealing with transition issues to make sure that we don't have to have this conversation much longer, because part of making sure our veterans don't wind up homeless is to make sure they can go from being an active duty service member to being a productive member of society. My background with homelessness and homeless veterans is I worked at First Presbyterian Church cooking at their soup kitchen for several years, which is right in downtown San Diego. My roommate from Navy SEAL training was on the Homeless Outreach Task Force working as a nurse, and so I have a real understanding of what's taking place in the veterans community and then also the homeless community writ large, and so I'm very thankful that this is Ranking Member Levin's legislative priority. And before we begin, I want to say it is nice to be here in Southern California. You see my face is a little red because I pulled the rookie move yesterday again. The overcast, don't worry about sunscreen, that happened. This campus is absolutely beautiful. I talked to some of the facilities ladies here earlier that get things set up. It was very kind of them to show us around. And I appreciate so much how the staffs have been working together, including Mr. Vogt, who was able to make it down to Coronado today to meet my SEAL brothers. That was wonderful. And then the people of the 49th District are lucky to have my ranking member as your representative. He's just doing a great job. Today we're here to discuss ending veterans homelessness in both the greater San Diego area and across the country. This topic is one of the reasons I actually ran for Congress, because I have a heart for this. Permanent housing is an essential component to a stable life after a veteran transitions out of active duty, and without a home, it's much harder to maintain a stable job, continue to acclimate to civilian life, and maintain mental health. This subcommittee in the past has done an amazing job improving programs for veterans, but we still have a lot of work to do. Improving the HUD-VASH voucher program, finding a new grant and per diem rate, retain VA employees that serve homeless veterans, and getting the VA to actually hire more employees with the funds Congress has given them are all areas that we're going to continue to work on. However, it is important that both Congress and the Department of Veterans Affairs administer and evaluate these programs in a way that ensures veterans are housed in a way that is fiscally responsible. And we got to find ways to fund these essential programs without putting a huge financial burden on the backs of the taxpayers now and in the future. These can both exist in the same universe. We also need to ensure that these programs we have already are paid for, that have been paid for by Congress, are run as intended, and we've got to pass programs without ever doing, we must pass programs and continue to do the oversight on them. And this can never be at the expense of veterans getting the services they need. Hopefully we're going to hear from the VA today and local government and community providers about the impact of programs the subcommittee has already enacted and find new ways to improve the lives of Americans' veterans. And simply put, we just have a lot of work to do. And I'm a retired enlisted guy, so I know how to work. I look forward to hearing from our witnesses about how they believe what works, what needs to be improved, and how Congress can employ them to ensure that no veteran goes unhoused across our country. I'll now yield to the ranking member for his opening remarks.
Well, thank you so much, Chairman Van Orden. I first want to welcome you and thank you for coming to our beautiful congressional district. I'm so glad that the sun is shining. I was a little worried when it was raining this morning, but very, very grateful to work with you in a collaborative manner, and also very grateful to both Ranking Member Takano, who did a wonderful job as our chairman for these past 4 years, and my friend Young Kim from not too far away in Orange County have also joined us. As I mentioned outside, these opportunities to get together on a bipartisan basis and learn about each other's districts and priorities are rare in the Congress of the United States, but I hope that you know our commitment to doing that on the House Veterans Affairs Committee. Today's hearing is centered around the need for all hands on deck, which in this case isn't a reference to the critical work of our Marines at Camp Pendleton or sailors down in San Diego. Rather, we're here to discuss how we can employ all available resources to end veteran homelessness in the San Diego region. The rate of veteran homelessness in San Diego County has dropped by nearly 30% over the last 4 years, and that's thanks to a lot of people in this room. And that's according to the 22 point-in-time count conducted in our communities, nearly 700 veterans are still experiencing homelessness, including 88 here in the city of Oceanside. In February of this year, the Board of Supervisors for San Diego County approved this all-hands-on-deck approach to reaching functional zero for veteran homelessness in our region. This approach will require the input, expertise, and hard work of every person in this room, and many others who weren't able to join us today, to reach our shared goal of ensuring that every veteran has a place to call home. So I want to thank all of the dedicated organizations, the practitioners, and the experts who are here with us today, some of whom you're going to hear from, who have been doing this critical work for a very long time and will continue doing so together. There's not a single cure-all to veteran homelessness, just as there's not a single cause of veteran homelessness. Homelessness occurs as the result of complex factors and experiences that veterans face, some of which may be related to their military service. That's why we must take a multifaceted approach to address the underlying specific needs of each individual veteran to ultimately end homelessness. I convened this hearing with my friend, Chairman Van Orden, who's doing a great job with that gavel, with the thought in mind to bring organizations across our homelessness prevention and response system together to speak how their services integrate to meet veterans where they are on their journey to stable housing. In as difficult of a time as we faced during COVID-19, we learned quite a bit about what it's going to take to end veteran homelessness and the three key elements of that solution: urgency, resources, and flexibility. During the pandemic, Congress acted swiftly to give VA and community providers the resources and the flexibility that they needed to ensure the safety and health of unhoused veterans. And that focused effort, influx of funding, and increased authority resulted in a reduction in veteran homelessness across the country, including here in the San Diego region. I'm working with Ranking Member Takano on a policy roadmap that'll outline key areas where Congress can remove barriers at both VA and HUD to ensure a veteran's path to a home is smooth and quick. A significant roadblock that I hope to discuss today relates to the ongoing issue of veterans with service-connected disabilities being rendered ineligible for permanent supportive housing built specifically to serve their needs. Often, when a developer undertakes an affordable housing project, they accept financial incentives that come with restrictions on the number of units that must be set aside for individuals or families at certain income levels. Generally, this is a great practice and ensures affordable units are set aside for those most in need. However, when calculating income for eligibility purposes, a veteran's disability compensation is included in that formula and often puts them over the limit. As a result, many veterans are deemed ineligible for housing specifically built for them, like permanent supportive housing where care and resources are directly incorporated. This problem is only going to get worse as more veterans receive benefits under the PACT Act. So I look forward to working closely with Ranking Member Takano to address this real obstacle to ending veteran homelessness, and I'm eager to hear today from our witnesses about this and other roadblocks Congress may need to address to ensure every veteran's housing security. We have with us on our first panel representatives from VA's San Diego healthcare system, good to see you, and National Homeless Program Office to discuss the various programs VA offers in the region to identify, treat, and house veterans experiencing homelessness. We also brought to the table two local housing authorities from right here in Oceanside and from San Diego County. The housing authorities play an integral role in the provision of permanent housing through the HUD-VASH program, which is the partnership between VA and the Department of Housing and Urban Development that connects veterans with a housing choice voucher and the supportive services that they need to thrive. I'll be interested to hear the latest updates on the status of HUD-VASH in our community and how we can improve the process to more seamlessly identify housing options and connect veterans in need of permanent housing. I'm also pleased that Matthew Wechter is joining us today from San Diego County's Homeless Court. We routinely hear and research shows that a top unmet need of homeless veterans is access to legal services. This innovative program employs practices that assist homeless individuals who have committed misdemeanors in accessing the services they need, with a focus on rehabilitation and addressing the root causes of their housing insecurity. Hope to see more of these efforts throughout the country as we continue the fight to end veteran homelessness. On our second panel, we'll hear from local homeless service providers who execute veteran-centric programs across the continuum. We have Interfaith Community Services, I see Greg up there, which operates emergency and transitional housing through the Healthcare for Homeless Veterans Program and the Grant and Per Diem Program. Their bridge and service-intensive housing in Oceanside bring veterans indoors to connect them with treatment options and wraparound services as they secure a permanent place to call home. We have People Assisting the Homeless, or PATH, which I'd like to welcome back to our subcommittee. PATH testified for us this past December in D.C. about their Grant and Per Diem program. Today we'll hear from them about GPD as well as the rest of their extensive service offerings for veterans, including rapid rehousing through VA's Supportive Services for Veterans Families program, job training and placement through the Department of Labor's Homeless Veterans Reintegration program, and permanent supportive housing through HUD-VASH. We also have Adjoin, which partners with VA's SSVF program. Adjoin plays a critical role in homelessness prevention and housing assistance for very low-income veterans and their families. They participate in executing new strategic VA resources like Shallow Subsidy, which is a vital tool to stabilize veterans in their permanent housing. And finally, we'll have Community Housing Works, an affordable housing developer. We know that a root cause of homelessness throughout our country is due to a lack of affordable housing. I'll be interested to hear the barriers that developers may face in constructing, operating, and getting veterans placed in their units. So I'm so excited to dive into the conversation today with our witnesses. I thank the chairman again for visiting our district in beautiful Oceanside. And with that, I yield back.
Thank you, Ranking Member Levin. I now recognize the Ranking Member of the full committee, Mr. Takano, for any remarks he may have.
Well, thank you, Chairman Van Orden, and thank you, Ranking Member Levin, for inviting me back to your district today. And it is indeed a lovely day here. It's great to be back in Oceanside again. Last July, I participated in the Economic Opportunity Subcommittee's field hearing on veteran food insecurity. I'm proud of the bipartisan nature of the Economic Opportunity Subcommittee and your commitment to hosting field hearings in each other's districts to hear directly from your constituents about what issues veterans face. I hope our committee will host many more field hearings throughout this Congress. Ending veteran homelessness has long been a key priority of mine. I echo Ranking Member Levin's statement that there is no single solution to ending veteran homelessness, and that it takes an integrated approach to alleviate housing insecurity. I appreciate San Diego and Oceanside's commitment to addressing the homelessness crisis with the urgency it deserves. Barriers remain to ensuring every veteran has a place to call home, but I am hopeful that Congress can act to make tweaks to existing law to remove unnecessary roadblocks. Throughout this Congress, I plan to work on a number of pieces of legislation with my colleagues that touch nearly every aspect of the homelessness services continuum. And ending and preventing veteran homelessness will take a concerted effort. VA has made tremendous strides in pursuit of this goal, and the number of homeless veterans has reduced by over 55% since 2010. Last year, VA housed over 40,000 veterans. Yet still, according to HUD's point-in-time count, roughly 33,000 veterans were experiencing homelessness in 2022. I'm interested in learning more about innovative approaches to homelessness prevention and how we may be able to more adequately address inflow into the system through shallow subsidies and rapid rehousing. I also want to fully open up the front doors of VA by ensuring veterans with other than honorable discharges can access the Health Care for Homeless Veterans program. I'm looking forward to hearing from transitional housing providers today about improvements we can make to Grant and Per Diem program to the Grant and Per Diem program to ensure organizations have the resources and funding they need to serve veterans on their journey to permanent housing. Now, on the permanent housing end of the continuum, expanding veteran eligibility for HUD-VASH and modernizing that program is a top priority of mine, and I believe will lead to significant reductions in the number of veterans experiencing homelessness. As Ranking Member Levin mentioned, we are working on a fix to to ensure that veterans with service-connected disabilities can access the permanent supportive housing built to meet their needs by adjusting how income is calculated for the purposes of eligibility for that housing. It seems backwards that veterans with service-connected disabilities could be denied housing, but it's happening in communities across the country, and I am intent on removing this barrier to ending veteran homelessness. The affordable housing crisis is one of the chief causes of homelessness, and nowhere is that crisis more apparent than here in California. Now, I'm pleased we will hear directly from affordable housing developer today, from an affordable housing developer today, about how we can encourage the construction of more housing units for veterans, including through project-based funding, project-based HUD vouchers. I believe that by giving VA and providers flexibility and fully funding the resources they need, they can better address the needs of homeless veterans in their care and communities who are moving through their system. And that's why I'm going to continue to fight for passage of H.R. 645, Congresswoman Shirflis McCormick's Healthy Foundations for Homeless Veterans Act, which extends VA's authority to pay for basic needs for veterans experiencing homelessness. And I'm deeply concerned about the effects that the May 11th expiration of that authority and the elevated grant and per diem reimbursement rate may have on VA providers and the veterans who need our help the most. Now, there are a number of other issues within homeless programs I hope to address this Congress and into the future, including coordinated entry, data collection, and access to legal services and program training. And I want to ensure that we are encouraging the guiding principles of housing first across our homeless response systems so that we are prioritizing permanent housing placements for veterans and securing the treatment and services they may need as well. I hope to hear ideas for how we can make the journey from at-risk or homeless to stably housed as smooth as possible for our veterans from our San Diego and Oceanside providers. So I thank the chairman and the ranking member again for letting me participate today in this field hearing, and I yield back.
Thank you, Ranking Member Takano. I would like to recognize my friend, Representative Kim, and thank her for making the drive down to the district. If you'd like to make some opening comments.
Thank you, Chairman Van Olden and Ranking Member Levin for holding this field hearing in Southern California on veteran homelessness and allowing me to participate too. I represent California's 40th congressional district, and most of my district is primarily in Orange County, but I do also have parts of San Bernardino and Riverside counties. I was looking up the statistics. California is home to 1.8 million former service members, and that's about a little over 5% of state's population. And that's also 1/3 most in the entire United States among all 50 states. So we have a lot of veterans here in the, in the state as well as in our respective districts. So there is a lot of concentration about making sure that we take care of our veterans and find out what the needs are, which is one of the reasons why in my own district I have formed a veteran advisory group where, I invite the veterans, those who work with the veterans, organizations, associations, so that they can come and have a regular conversation with me so I can find out what the needs are, what resources we have at the federal level that we can dispense to the communities. So in my district, like I said, we have a number of nonprofits, government, and law enforcement agencies and health agency partners that are designed to increase collaboration on finding, temporary shelter, connecting homeless veterans to healthcare and addiction services, and enrolling veterans into reintegration programs and help them find stability and re-enter the workforce. We got a lot of work to do, but that's one of the reasons why I took the time to drive down here to listen from the veterans, those of you who are working closely with the veterans, to give us some ideas on how we can better our work as members of Congress to disseminate and help our veterans better. So thank you so much for, again, inviting me, and I look forward to hearing our witnesses talk to us. Thank you.
Thank you, Representative Kim. I'm going to ask the witnesses on the first panel to please stand and raise your right hand. Can you do that back there? Man, they got you in a tight spot. Raise your right hand, please. Do you solemnly swear that the testimony you're about to provide is the truth, the whole truth, and nothing but the truth? Yes. All right, thank you. Let the record reflect the witnesses have answered in the affirmative. Please take your seats. Before we get started, I'm a retired Navy SEAL. There's a clock that says 5 minutes. That's when you're stopping. Okay? And I will hold myself to the same standard, just so you know. All right. Mr. Pearson, you're now recognized for 5 minutes to deliver your testimony on behalf of the VA witnesses.
All right, good afternoon, Chairman Van Orden, Ranking Member Levin, Ranking Member Takano, and Congresswoman Kim. My name is Dr. Frank Pearson. I'm the Director of the VA San Diego Healthcare System and the Jennifer Moreno VA Medical Center. I am accompanied today by Jill Albanese, Senior Advisor and Director of Clinical Operations, VA Homeless Programs Office. Thank you for the opportunity to testify on the topic of veteran homelessness, the work in this area by my staff at the VA San Diego Healthcare System, and the challenges that we face in our efforts to end homelessness among veterans in San Diego. The VA San Diego Healthcare for Homeless Veterans program collaborates with many community organizations to combat veteran homelessness. It all starts with identifying at-risk homeless veterans and then helping them with the continuum of care and services. The most common way to document veteran homelessness is through the annual point-in-time counts. As stated, in 2022, the point-in-time count recorded almost 8,500 homeless individuals in the San Diego region. That was a 10% change since 2020. 686 of these individuals, 8%, self-identified as veterans. These statistics reflected a 27% reduction in the veteran homeless population since 2020, which was a welcome trend in the right direction. While the success leads that of other large cities on the West Coast, VA San Diego struggles to meet some of the national VA goals for permanent housing placements. Our calendar year 2022 goal was 842, and we achieved permanent placement for 704 veterans. The written testimony submitted explains some of the reasons why. There are new 2023 goals, and VA San Diego is implementing and has implemented several initiatives aimed at increasing permanent housing, decreasing recidivism, and engaging with veterans facing homelessness. In many ways, the COVID-19 pandemic provided advantages that enabled VA San Diego to assist homeless veterans. Namely, the City of San Diego utilized the convention center to ensure that all individuals and families struggling with homelessness had access to shelter, basic necessities, and services. This allowed the VA San Diego to increase collaboration with community partners, to streamline services and focus engagement efforts in one location. VA programs had over 200 admissions into HUD-VASH, and 135 veterans were transferred directly from the convention center to housing in 2021. Other factors that came about because of the pandemic included special funding flexibilities provided through Section 4201 of the Veterans Health Care and Benefits Improvement Act of 2020. That was greatly appreciated. That law authorized the Secretary of Veterans Affairs to use appropriated funds for life-saving food, shelter, goods, and services for homeless veterans or those participating in the U.S. Department of Housing and Urban Development Veterans Affairs Supportive Housing HUD-VASH during the pandemic. That funding, as you know and as has been stated, is set to expire soon, and that's a bad thing, potentially. In San Diego, the VA uses those funds in many ways. In an extremely competitive housing market, 4201 funding approval enabled an increase of the maximum grant per diem rate for grant recipients. Programs such as rideshare enabled over 4,400 rides for homeless veterans to get to our clinics for medical care. Supportive services for veteran families provided hotel vouchers for veterans and their families awaiting permanent housing. Funding flexibilities also allowed VA San Diego to form new partnerships with organizations like Brilliant Corners to engage in community programs such as landlord engagement and assistance and other San Diego County landlord assistance incentive programs, and similarly LEAP in the city of San Diego. By definition, the search for affordable housing is a key part of our efforts to reduce veteran homelessness. But there are many programs in our continuum of care that address some of the root causes of homelessness. We use clinic and street-based outreach to engage veterans and provide resources and referrals. VA transitional housing programs offer both grant and per diem beds and contract residential specialty beds. The VA Homeless Patient Aligned Care Team offers walk-in and scheduled appointments to more than 300 enrolled veterans. The Veterans Justice Outreach Program provides resources, referrals, and case management service for veterans who are incarcerated, on probation or parole, or otherwise in need of homeless court advocacy. and VA San Diego Employment Readiness staff members assist homeless veterans overcoming housing instability as they seek employment. VA San Diego healthcare system is committed to ensuring veterans have access to the housing resources and services they require and deserve. We are working to improve access to programs designed to meet veterans' needs. Thank you very much for the opportunity to appear for you here today. We truly appreciate the many resources that Congress has provided the VA so we can care for our nation's veterans. Now we are happy to respond to any questions that you may have.
You made it. Just so you know, Mr. Pearson, I read all of your testimony already. So thank you very much for that. And the written statement of Mr. Pearson will be entered into the hearing record. Ms. Hines, you are now recognized for 5 minutes to deliver your testimony.
Good afternoon, Chairman Van Orden, Ranking Member 11, members of the committee, and the public in attendance here today and virtually. My name is Leilani Hines. I'm the Director of the Housing Department and Housing Authority for the City of Oceanside. Oceanside in particular has long been defined by its neighbor, Marine Corps Base Camp Pendleton, with over 42,000 active duty personnel, 73% of which live off base, and more than 77,000 retired personnel residing in the San Diego region. Many of these active, retired, and discharged service members and their families make Oceanside their home. And since 2015, this region has worked towards functional zero for the homeless population and veterans, and we've seen an overall decrease, as it's been stated. But that's not necessarily the case here in Oceanside. We've experienced a significant increase in our point in time from 5 persons in 2020 to 88 in the last count. Oceanside is in collaboration and works to support leadership efforts of our continuum of care, committed to the National Built for Zero initiatives, the Board of Supervisors that have adopted a county framework for ending homelessness, creating that unified strategic approach to support coordinated services and funding. As part of this effort and the growth of homelessness in contradiction to the region in Oceanside, what we bring to the table are our HUD-VASH vouchers, 100 vouchers. But as you often hear the media and cause for concern for many in our community, it's the lack of affordable housing and a competitive rental housing market that is a big contributing factor for the use of housing choice vouchers. To address this and to meet the challenge, the city does use the 120% of our fair market rent for its VASH program. We utilize zip code level small area FMRs that better reflect rents within our individual neighborhoods to meet those high costs and the changing market in Oceanside. The temporary change in the FMR methodology employed for 2023 incorporates private market rental data that will help us to close that gap in high housing cost markets like Oceanside, where we see a median rent of $3,400 a month, $100 a month increases in rents from March to April 2023, and an $800 increase from the same time last year. Consumer choice for our veterans, self-determination, housing stability are dependent upon the availability of housing and its affordability. And so where opportunities arise, the city does work with our private market developers to stimulate development, expand our available housing stock, particularly through project-based vouchers. And Oceanside has committed to full utilization of 20% of the program cap for PBVs, the additional 10% for permanent supportive housing to just support housing affordability. In recent years, you've seen all 3 of our housing authorities dedicate PBVs to a number of permanent supportive housing developments. And as a local municipality, our impact on the market is truly limited and to services. We can, however, take proactive measures to outreach, make known the availability of resources to the community to connect potential VASH-eligible veterans with our local San Diego Veteran Affairs Medical Center. We can help to educate and engage landlords and property owners of participation in the voucher program, the benefits, the availability of incentives we have, and the services that can be available through VASH or even the EHV program. While we as a local jurisdiction, we've all committed to doing what we can, there is more to be done for veterans experiencing homelessness. As the county has alluded to in their written testimony, VASH vouchers left on the table are left on the table and available. We've utilized only about 50%, nearly 50% over the last few years of our VASH vouchers. That's lost opportunity. And our use of VASH vouchers is truly relying upon direct referrals of the VA and their case management services, and that's what impacts the greatest higher utilization of our services. Our referrals have been slow and trickling in, and we continue to examine ways in which we can partner to strengthen those relationships and increase our referral rate. In the future, what we would ask for you to do is we will work together as municipalities, our COC and the RTFH. We hope to identify referrals. We hope that we increase program caps for PBVs as a useful financing mechanism. As Ranking Member Levine has championed, we urge the legislator to think about the methodology of the FMR and to go beyond 2023 and to incorporate that data. And
The
lastly,
gentlelady's time has
increasing.
expired. Thank you
you.
very much. Ms. Hines, I read all your testimony too, in
Thank
case you're
you.
wondering. Yeah, I owe that to you. The written statement of Ms. Hines will be entered into the hearing record. Mr. Estrella, you're now recognized for 5 minutes to deliver your testimony.
Good afternoon, Chairman Van Orden, Ranking Member Levin, and members of the committee. Welcome to the County of San Diego and my hometown, Oceanside, California. My name is David Estrella, and I am the Director of County of San Diego's Health and Human Services Agency, Housing and Community Development Services. As such, I also represent the Housing Authority of the County of San Diego. San Diego County is a proud military community. San Diego has the largest concentration of military and veteran presence in the world, with approximately 120,000 active duty personnel and 230,000 veteran residents. The majority of our active duty service members are split roughly between the Navy and Marine Corps, serving among our 8 military bases in the county. According to the Regional Task Force on Homelessness, there are nearly 1,000 veterans currently experiencing homelessness in our region. Over the last several years, the San Diego County Board of Supervisors has demonstrated its commitment to addressing the needs of all people experiencing and at risk of homelessness. The board adopted the county's framework for ending homelessness in 2021, which created a unified strategic approach to support the coordination of homeless services and funding. On February 7, 2023, the board formally prioritized ending veteran homelessness in the region. The County of San Diego will join community partners and other local municipalities in developing and implementing a regional strategic action plan to achieve functional zero for veterans homelessness within a 15-month period, and maximize available resources to meet our veterans' housing needs across the region. The introduction of the Veterans Affairs Supportive Housing VASH program in 2008 has been a key contribution to an over 55% reduction in veteran experiencing homelessness nationwide since 2010. According to San Diego's regional 2022 point-in-time count, while the number of persons experiencing homelessness saw an overall increase, veterans' homelessness in the region decreased by over 350 veterans since the 2020 report. The County of San Diego has engaged and working with the U.S. Department of Veterans Affairs and other partners to address the challenges in the region. Some recent highlights of the county's effort include enhancing county outreach, educating and engaging landlords, and enhancing the county's landlord incentive program to reduce the amount of time between voucher issuance and lease up in a very competitive rental market. Connecting veterans with units by providing vacancy leads through our landlord liaison, and streamlining the administrative process to increase efficiencies and reduce barriers. While remarkable progress has been made, there is more to be done to help veterans experiencing homelessness. According to the February 2023 U.S. Department of Housing and Urban Development dashboard, there are 2,334 VASH vouchers allocated to 3 housing authorities in the San Diego region, while the Housing Authority of the County of San Diego, the San Diego Housing Commission, and the Oceanside Housing Authority have over 1,670 veteran families leased in units and receiving VASH assistance. Over 650 VASH vouchers remained not utilized. In order to get our veterans off the street and into housing, an additional outreach and referrals from the local VA are needed throughout the region. In 2022, the county received an average of less than 11 referrals per month. Recognizing the need to increase outreach and referrals in the Housing Authority's jurisdiction, the San Diego VA MC has recently secured a contractor to assist the VA with outreach and referrals. So far in 2023, the county has received an average of 15 referrals per month. While we anticipate seeing the referral numbers continue to grow in 2023, the current pace is not nearly enough to fully utilize the vouchers within the next 12 months, and still leaves too many veterans far too long without a place to call home. Where the county has been successful in applying to HUD and bringing additional vouchers to the region in the past, the inadequate referral rate has made the County Housing Authority ineligible to apply for additional VASH vouchers based on utilization rate thresholds. Not being able to apply for additional vouchers is a missed opportunity. We can enhance the San Diego VA-MC's capacity to identify and refer homeless veterans by expanding the local VA's current third-party referral contract. Additional strategies that would help streamline access to VASH vouchers for eligible veterans include expanding program-wide VASH waivers to align with flexibilities already allowed under the Emergency Housing Voucher Program and Stability Voucher Programs. Increasing the amount of VASH project-based vouchers, or PVVs, that the local VA will support per proposed housing development. Currently, there is a limit of either 10 VASH PVVs per development or 10% of the development's units, whichever is greater. This minimum should be increased. Thank you for your time, and I'm happy to answer any questions that you may have.
Good job. You made it. Mr. Estrella, thank you very much. Yes, thank you very much. And your written statement, which I did read, will be entered into the record. Mr. Is it Wechter?
Wechter.
Wechter, you're now recognized for 5 minutes to deliver your testimony.
Thank you. Good afternoon, Chairman Van Orden, Ranking Member Levin, Ranking Member Takano, and Representative Kim. My name is Matthew Wechter. I am the Deputy Public Defender supervising the Pretrial Advocacy and Community Connections Unit of the Public Defender's Office. On behalf of the County of San Diego Department of the Public Defender, our Chief Deputies, and the members of our office, thank you for inviting me to testify on this issue. Since my first years as an attorney in this office, now over 13 years ago, it has been clear to me the strong commitment that the San Diego Public Defender and our collaborative justice partners and the greater County of San Diego community has to serving our homeless veteran population. But we can do better in two ways. The first is best addressed by my panel colleagues today, increasing the housing and other non-legal resources available that they need. And the second is to eliminate the legal barriers to being able to utilize and meaningfully receive those resources. And that's what I will focus my comments on today. In my written materials, I discussed how important the Stand Down event has been and continues to be for our county and our community members and beyond. The way I've always heard Stand Down described is you take a step, we take a step. You walk in and ask for help, and we will walk with you. Homeless Court started at Stand Down 34 years ago as a collaborative justice effort between the public defender, district and city attorneys, and the Superior Court, and continues to be one of the biggest, if not the biggest, service provider at the event. In fact, most years at San Diego High School's field, the veterans are lined up early just for legal help. The public defender is there in force. I call it the Public Defender Army, with over 50 volunteers over those 2 days there to meet the incoming veterans looking for help. In return for coming to the event, engaging with services, and working on themselves, the public defender and the court partners can now research their cases, look for outstanding warrants, locate DMV holds, pull those cases, and remove those barriers on the spot. Never let a pandemic go to waste. We now have that technology to do this in real time with a click of a button. But criminal case, fine, and relief is just the start of what legal help is available at Stand Down. DMV, Legal Aid, San Diego Volunteer Lawyer, Child Support Services, League of Women Voters, County Assessor Recorder, helping with birth certificates. It's a one-stop shop for a veteran looking for a way out of that cycle. They take a step, we take a step. But that's only 3 days a year, 3 days twice a year in San Diego. What about the rest of that time? Well, our monthly formal homeless court program operates 12 months a year with the VA, PATH, Interfaith, Adjoin, and over 90 other approved homeless court providers in this community, able to refer their clients and participants to clear these legal barriers once they have met those program requirements. But San Diego wasn't satisfied there either. In 2021, on the heels of the pandemic, that same collaborative spirit among our county and community partners also begun using the model of Homeless Court at Stand Down to institute Homeless Court pop-up resource fairs throughout the community to remove immediate barriers, and we hope to expand those to twice per month in the near future. The Homeless Court pop-up model of hyper-local, meet them where they are action is gaining traction through the American Bar Association's Commission on Homelessness and Poverty as well. In fact, I just returned from Charleston, South Carolina, supporting their first Homeless Court pop-up resource fair last Friday, and there are already discussions to plan their next one. If you sense a theme to my opening comments today, it is meeting the unhoused person where they are to lift that barrier. For the veteran, they came out for us when we needed it, and now we will come out for them and address their needs. Sometimes that first step is the hardest, and the public defender and the other community collaborative partners will be ready to take those steps with them. While this is a field hearing in San Diego, veteran homelessness is not unique here. I extend the invitation to any and all the members of this subcommittee to join us at any of our Homeless Court pop-up events, our monthly Homeless Court program graduation, or our stand-down event this July to see it in action. And if you're interested in this type of event in your community through the American Bar Association on Homelessness and Poverty, I'd be happy to make that connection with your community as well. Thank you, and I'd be happy to answer any questions the committee has.
Thank you, Mr. Wechter. The written statement of Mr. Wechter will be entered into the hearing. We'll now proceed to questioning. I ask members and witnesses to respect the 5-minute rule. I think we covered that. And I now recognize myself for 5 minutes. Ms. Hines, you said it's 30, and I read it, but I didn't see what type of apartment costs $3,400. Like, how big is that?
So that would be like a 2 or a 3-bedroom unit. Our 2-bedroom units go anywhere from $2,400, $2,800, and then 3-bedroom units upwards of $3,000 to $4,000.
Okay.
If you've been to the Oceanside community, we've
Oh, yeah.
had a renaissance, if you will, and a lot of new physical developments coming online.
Okay, so that would be for a family then.
Yes, it would be.
Okay, thank you, ma'am. Mr. Wechter, what qualifies a veteran as homeless and allows them access to your services?
So the good part about the way that our community has done it, it is homeless or at risk of homelessness, which really opens it up and makes it so that we have as much eligibility as possible.
Okay.
When a person comes, there might be suitability issues, but eligibility is as broad as possible.
Okay, excellent, thank you. Dr. Pearson, as you know, Southern California is an area with a significant defense presence. We've discussed that. And members of the armed forces in the community make the transition of the military to civilian life every day. There's about 750 members of the Naval Special Warfare community do this annually. Can you please discuss how the local VA Medical Center collaborates with the nearby naval and marine bases to ensure that service members who may not have a housing plan as they exit the military are connected with the resources they need? And then the second question is, does the Department of Defense provide warm handovers directly to the local VA for service members who do not have a housing plan?
Okay, thank you for that question.
Yeah.
So the military offers a transitional assistance program for military members that are exiting the Navy or any military service. I'm a 37-year veteran myself, and having been a commanding officer, I'm very familiar with this. And so, the military actually has a very good program for people that are going to be medically disabled, and there's a very significant handoff. As we've had in this community with wounded warriors and everything, we have a very strong connection between Camp Pendleton and Navy Medical Center San Diego for those veterans, soon to become veterans. And so there's a really good handoff process there. When military members are exiting the military, they go through TAPS. They get representatives from the VA who come to share.
Dr. Pearson, I don't want to cut you off, but I have limited time. I was just doing the stuff with this. I want to make sure that the DoD is not, like, they're not chilling you out. And it sounds like they're not so far from your perspective, but I'm going to follow up, have my staff follow up with you, if that's all right. Ms. Albanese, is that correct?
Yes.
Yes, okay. Can you discuss the disparity in the treatment of veterans' federal service disability payments between the most federal agencies and HUD, and how this affects veterans' ability to get affordable housing?
Yes, thank you for the question. What I can tell you is of the veterans that are currently enrolled in all of our homeless programs nationally, about 20% of those veterans would be over income for these projects that Mr. Levin described. So it is a significant number of veterans who would not be eligible for those project-based because they're over income, even though they have a service-connected disability.
Okay. Yeah, that's unacceptable. We're going to work on that. And here's kind of a general question, but Doctor, I'm going to start with you. I want to know what actually goes into trying to deconstruct this problem, because I read all this stuff again, and I don't see a lot of upstream solutions. With that transition program with Naval Special Warfare, they start 24 months out, making sure that these service members, they start off in a productive way. So can you tell me a little bit about the upstream solutions that you're working with that could potentially help this? Because you have a active duty serviceman or woman who is performing incredible functions, and then they wind up in a bush on a corner. That just didn't happen. So I really want, and I know Ranking Member Levin is all over this, I want to try to deconstruct that problem so we can prevent getting here. So the reason being is I'm not sure that the at-risk, I think that's too late at that point. Can you address that?
Sure. So the VA has a move to VA program, and so that's one program that's helping to facilitate resources for military members who are transitioning. We also have veteran resource centers, and we actually just opened up a brand new one at the VA hospital here recently.
Okay. With that, I yield back. I now recognize Ranking Member Levin for 5 minutes to question the witnesses.
Well, thanks again, Mr. Chairman, and thanks to everybody on the panel for being here today, for all your excellent work in the community. I wanted to start by discussing barriers to affordable housing for veterans, and one of the most important tools that we've got to improve access is the ability to project-based HUD-VASH vouchers. We've been talking about that a bit. Project-basing vouchers effectively sets aside units in a building or development so that there's a dedicated housing stock for veterans. My understanding is that there's been a slow uptake in project basing in the San Diego region, despite the difficult reality that many veterans face when competing in the rental market, as we've been discussing, with a tenant-based voucher. So I'd like San Diego and Oceanside public housing authorities, as well as VA, to please discuss the barriers to project basing HUD-VASH vouchers in our community and any solutions you're working on to ensure that there are units available for veterans. And let's begin with Mr. Estrella.
Thank you for your question, Ranking Member. So the discussion of project-based vouchers starts as a financing discussion, and it's a form of subsidizing permanent affordable housing. Typically, VASH project-based vouchers are included amongst a package of either housing choice project-based vouchers and other types of financing, state tax credits, or state financing for veterans housing, et cetera. So typically what you see is a voucher that's a set aside for veterans within a larger affordable housing development. So glass half full, part of the question is that it's a portion of financing, so it doesn't carry the full burden of affordable housing development, but it's part of a broader challenge, which is financing affordable housing development generally. So the more project-based vouchers that are made available that are VASH vouchers, that increases the probability that the project will be, the affordable housing development will be financially solvable over long term, it'll be operational, et cetera. So in summary, affordable housing finance is very difficult, particularly in the San Diego region and California region. VASH vouchers, as project-based vouchers, are a tool that can be used. Expanding that tool allows us more freedom to build more housing.
Ms. Hines, I'll ask you the same question.
I think my answer would be very similar to David's response, but project-based vouchering is absolutely necessary when you do financing for the extremely low or very low. When we look at a development, you can have upwards of 6 different funding sources coming in. We recently approved Greenbrier Village, which is a 59-unit permanent supportive housing, all VASH or all project-based vouchers with 5 VASH vouchers. The equivalent value of those project-based vouchers was about $21 million. So you can't do permanent housing without project-based vouchering. And so the more that we have the ability to use project-based vouchers, the more housing stock we think that we will be able to get at those extremely low or very low income levels.
So why don't we do more of it? You just think it's a financing matter, as Mr. Estrella referred to?
At times it's a choice. We in Oceanside have committed to using the full maximum. We are obligated under the legislation to only use a maximum of the 20% of our vouchers. So increasing that maximum will help us to do more affordable housing, and then it becomes a choice of a developer or a partner, and in the case of the VASH vouchers, the VA, as to how many of those they'll use for a targeted population group.
Dr. Pearson, I'll turn to you for my last minute in the hope that we will have another round, because I got a bunch more questions, if you're willing.
Certainly.
Dr. Pearson.
Absolutely. Thank you for the opportunity. So I'll make it very quick. So we have 76 project-based vouchers for the city, 13 for the county, and none for Oceanside. So I'd say there's an opportunity there.
Zero.
Zero.
For Oceanside.
Right.
Wow.
Project-based housing, yes.
But you don't think that so do you agree with the general premise that it's the financing that's the challenge?
You know, that's at a different level than what I get involved with, but
Okay.
I certainly think there's, cost has something to do with everything these days. So absolutely.
Okay.
Can't dismiss
And
that.
do you have any insight on why Oceanside hasn't had any of these projects?
No, sir, I don't.
Okay. Ms. Hines, do you have any insight on this?
We just started to get into the game of project-based vouchering, and so as I discussed, the Greenbrier Village project was just awarded funding this year.
Out of
and
time. Sorry. Okay.
Thank you very much. And, at the request of Ranking Member Levin, we will do a second round of questioning. So we'll get to, of course, no. I now recognize Ranking Member Takano for 5 minutes to question the witnesses.
Thank you, Chairman Van Orden. I want to follow up on the chairman's questioning on veteran eligibility compensation. Mr. Pearson, how often does this issue of veteran disability compensation, putting veterans over the income eligibility requirements for a unit in a permanent supportive housing complex, how often does it present itself in the San Diego area?
Surprisingly, it's not significant in San Diego because there's plenty of housing to be able to, as far as when we're talking per diem and we're talking about AMI rates, the rates that are currently available meet the number that were allocated. So there's sufficient allotment for what we're available to do. Does that mean that project-based housing wouldn't appreciate an increase? No, because that would probably make an eligibility for more housing available there.
So you're not saying you don't encounter this that often?
That's right.
But does it happen? from time to
Sure,
time?
yes, and I'm very
And so
familiar with GLA.
what happens when it does happen to veterans who are turned away from accessing a unit in permanent supportive housing because of their their disability compensation? What do you do in
Sure.
that case?
I would like Ms. Albanese to help with me with that.
Sure.
Sure. I can tell you one of the consequences is that when a veteran does not qualify for these project-based, then they're able to use a tenant-based voucher because San Diego has made those vouchers available. So folks can get vouchers if they're up to 80% area median income, which certainly does help. And it sounds like Oceanside is even 120% of FMR. So that's hugely helpful. But when you're a veteran and you have a voucher, you're competing with everybody else in the rental market, right? So using a voucher, you're already at a little bit of a disadvantage. That means that you have to go through an inspection. You have to figure out how you're going to get the deposit. It's a very competitive market, and so, again, I would say that can put a veteran at a disadvantage if they cannot take advantage of the project-based units.
Well, thank you for that. Let me go to Mr. Estrella. One critical step Congress took during the COVID-19 pandemic was to authorize emergency housing vouchers, or EHVs, through the American Rescue Plan. EHVs were created to help pay rent for individuals or families at risk of or experiencing homelessness. The new program came with higher rent caps, extra money for landlord incentives, and laxer documentation requirements than housing choice vouchers. The San Diego Public Area Housing Authorities were extremely successful in using their EHVs, unlike many other communities in California and across the country. I've been working on legislation that would expand administrative funding for the HUD-VASH program to mimic the EHV program. Can you please discuss, I see some nodding heads over there. Can you please discuss why San Diego was successful in utilizing its emergency housing voucher allotment? If you can't, I'll turn to them.
So thank you for your question. I think it's a reflection of the collaborative efforts across the region, including the Regional Task Force on Homelessness, all of the housing authorities working together. Those vouchers were issued during a very difficult time. And I think just the collaboration that came through, quick referrals, quick processing, and the administrative efficiencies that came with the program that would very much benefit, is very much modeled and similar to VASH. I think those kind of administrative efficiencies help us to get the vouchers out in a quick fashion. I think that's best way to
Do
respond.
you have
Thank you.
anything to add very quickly, either one of you?
I do. In addition to that, it's all about the dollar. So they gave efficiencies of being able to provide deposit money immediately, whereas HUD-VASH doesn't do that.
And so are there any other lessons from the AHV program that we could apply to other subsidies like HUD-VASH that you would add besides that? Or is that the key one?
That's the key one, sir.
Okay, Ms. Albanese. Ms. Albanese.
I would just say that we absolutely would support having those same benefits that were included with the emergency housing vouchers, included with HUD-VASH. It would be a game changer for us, sir. So we absolutely appreciate that consideration.
Well, it seems like the previous issue I raised, which is an issue in other parts, which is the eligibility cliff. It seems like that's not such a problem, but you're all showing a lot of enthusiasm around this particular reform that I just mentioned about.
I would say that it is a bigger problem in other communities than it is in San Diego. Not every housing authority chooses to raise their eligibility limit to 80 or 120% of fair market rent. So while
I'm gonna have to.
Okay, thanks.
Cut us off here. Thanks.
We'll have a second round if you want to follow up. I now recognize Representative Kim for 5 minutes.
Thank you, Chairman. As all of our witnesses know, the veteran homelessness is a problem that can be prevented if veterans are connected with our local, state, and federal resources before they become homeless, right? We can think about the mental problems, the emotional health and substance abuse are often the factors contributing to veteran homelessness. But I want to ask all witnesses, and this is open to all of you, what are some of the examples at any level, like state, federal, and local levels, that have worked well at preventing our veterans from becoming homeless? Anyone can go first.
I can say that one of the programs that we see that has worked very well has been the supportive services for veteran family programs. It does provide prevention services. One of the things that we're looking at utilizing SSVF for is to use our shallow subsidy intervention a little bit further upstream. Some folks are at risk of homelessness just because they don't have enough income to pay their rent. So for those folks, a shallow subsidy makes sense. And just to explain, the shallow subsidy pays up to 50% of someone's rent. So we do feel like we can use that intervention, encourage our grantees to use it further upstream. It will reach a broader population. So that's one of the things that we're looking at.
Does anyone want to?
Thank you, Congresswoman. I guess what I would add on top of that is an understanding, one, that this discussion is a discussion of poverty when we're talking about homelessness generally. I think you were referencing that. Two, any response that we provide should be multidisciplinary in nature. Our housing authority is a part of Health and Human Services Agency, which means we leverage all the services that are available through self-sufficiency and behavioral health services and everything that's offered through HHSA. And then understanding that it's a regional effort across multiple jurisdictions, including, in our case, it would be the Regional Task Force on Homelessness and all the wonderful providers that are part of our RTFH. So it is very much a comprehensive approach. Less silos and more cooperation generally yields better results with the resources braided along with that, and understanding that health also plays a part in that. Thank you.
Thank you so much. We know that a major issue with veterans getting the benefits and resources that they're entitled to is that we do not know who they are, and we don't know where they are. That's probably the major issue, right? So in California, as you probably already know, we have added the voter identification or veteran identification to driver's licenses. So we can now allow the local veteran service offices, VSOs, to have more accurate method of educating our veterans on resources that are available to them. But outside of this, what are the best practices that you can share with us when trying to connect veterans to local resources and the resources that have been proven effective?
I would offer that, if a veteran is connected to the Veterans Administration, we, through our medical system primarily, and through our caseworkers, our social workers, we are going to identify those issues, and we're going to connect them. We're going to provide every intensive resource that's available to be able to connect them. But the important point is, as you stated, is identifying them. It's difficult unless they're connected to us. And so I think there are also opportunities to identify those people that are transitioning from the military. And then once they connect with the VA, we've got a great opportunity.
Is there any other methods that you can share?
Thank you, Congressman. I would say it's meeting them where they are with these types of resource fairs, because they're not just homeless, right? It's homeless or at risk of homeless, or really anybody that walks up. When we have the representatives from the VA, from our VJO team in San Diego, which is amazing, they're there to actually discuss what benefits they might have. They might not know. So having the access in the community where they are is, I think, a crucial step.
We will definitely want to work with you. I have my veteran resources staff that works on this. We have veterans resource fairs coming up. You mentioned the pop-up events for the homeless veterans. We'll love to team up with you and then get the information out and collect their information as well. So hopefully.
And Orange County just actually wanted to switch that model too. Thank you.
Thank you. Thank you, Chairman.
You get, thank you, ma'am. We will now proceed to our second round of questions. With that, I recognize myself for 5 minutes. Dr. Pearson, to ensure every veteran has a permanent home, we also have to work towards employing every veteran that wants to work. And currently, the VA San Diego has 2 employment specialists to provide services to 173 veterans. And do you think this is an optimal number, or should they have more employees helping veterans?
So we're actually in the process of hiring an additional employment specialist at this time. So we'll have 3.
You'll have 3.
Yes,
Okay.
sir.
What is the linkage between your folks there with the state and federal Department of Labor folks?
That's a great question. And Salmonese, can you help me with that?
Sure, I can tell you from a national level, we do work closely with them. There are lots of opportunities for us to work with our federal partners, and we certainly do work closely with them to look at opportunities for veterans and to look at potential policy issues as well as additional programs that may need to be developed to help our veterans become employed.
I would also add that, we have USA Jobs. It's a wonderful, actually, website that we're trying to create more efficiencies with, but there are a tremendous amount of opportunities, particularly for the veterans there.
Okay. And Doctor, I want to get a little more into the upstream solutions here, because we're also responsible for the Transition Assistance Program. And I don't want to use the word obstructionist, but I'm going to. I found the Department of Defense to be obstructionist when it comes to allowing us to access our Transition Assistance Program. So maybe other than you, I had a terrible experience with the Transition Assistance Program. I thought it was nearly meaningless. And so I want to work with you guys to make sure that you know that there are some very quality things out there that we can implement, but we have got to break through that with the Department of Defense. I mean, I know you're trying to help. I know that we're trying to help. I also know that it's my responsibility to make things better to the best of my ability. So I need to know with the TAP program, what could we potentially do, again, to prevent the productive service member who, man, I lived in a bush on purpose for a long time, right, as a Navy SEAL, to prevent the person from doing that to living in a bush because they have to. So are there any other things that you could think of, or really across the board, I have a little bit of time, that we could get into the TAP programs that could help prevent that veteran from becoming homeless or even the at-risk?
One thought, having gone through TAPS just within the last 5 years, is maybe more dedicated time that actually we afford, maybe even a VA day. Speaking honestly, that most veterans or most people that are transitioning are very interested in finding out ways of compensation. We don't really spend a whole lot on examining the whole person. So VA has a whole health program that doesn't just take you from benefits and everything, but it's looking at your whole experience of life. And part of that is how you're transitioning and taking care of yourself. So that's a recent program that the Veterans Administration has. It's been growing and growing. to include employees, but it's a great opportunity to actually introduce it there at TAPS.
Okay, before we leave, I want my staff to give you a copy of the unclassified document that we got from Naval Special Warfare today, which is now an MFP 11, which it's a programmatic thing through the Special Operations Command for the transition stuff, because I think it's nailing what you're talking about. So before we go, take a look at that, and then I'd like you to just give my personal phone number, if that's okay. Give me a call.
Absolutely.
I want to talk to you about this, because...
I was Deputy Force Medical Officer there in 2015.
Oh, were you really?
I was.
Oh, what's up, man? All right. Well, with that, I yield back.
Mr.
I know,
Chairman,
Rick.
before you yield back all your time, might I suggest we also look at the Skills Bridge program, but we also look at some jurisdictional changes your experience with DOD makes me think, we've discussed it when we were in the majority, the prospect of expanding this committee's jurisdiction over some programs that DOD runs, like Skills Bridge, for example,
Yep, right.
which is a 6-month time period that those service members still are getting their food and their pay, but could be doing apprenticeship programs, et cetera. It might get better attention from us than it does from armed services, for example. So I might suggest the majority look at that.
Well, we will.
Yeah.
Thank you very much. And I yield back. I now recognize Ranking Member 11 for your 5 minutes.
Thank you. And as a former chairman of the subcommittee, I concur with what Ranking Member Takano said. It's been a constant struggle trying to get the attention of the DOD and the jurisdictional issues and the HVAC HASC delineation has been a challenge. So we just have to keep working at it. Dr. Pearson, appreciate all the hard work that you're doing at the Jennifer Moreno VA Medical Center on many levels, but one thing is to hire and retain HUD-BASH case managers, particularly since we passed the Isaacson-Rowe Act a couple years ago. These case managers have some of the hardest jobs I could think of, some of the highest caseloads of any VA employee, and I'm really grateful for their commitment to the mission of ending veteran homelessness. How has the medical center addressed the high cost of living in our area, which frequently makes it difficult to find and retain talent that can afford to work and live in our region?
Thank you very much for your question. So we have a number of things, and PAC Act actually has been one of the great benefits of late. So we've looking at some of our very hard to recruit, hard to retain positions, and it has afforded some flexibility such as retention incentives. And so that has been very key to actually being able to keep on existing staff. And we look at recruitment bonuses also for staff that we want to bring on. So that's been a necessity and very thankful to Congress for helping us in getting that passed.
Well, let's continue the dialogue on that. When we look at HUD-VASH voucher utilization rates, we often associate a lower rate of utilization with a lack of available case managers to staff the vouchers. I remember a conversation I had with your predecessor about this. Here, you're operating with a high number of your case manager positions filled, yet the voucher utilization rate remains relatively low with our two public housing authorities represented here. Can you speak to why voucher utilization rates remain low with these PHAs and any ongoing efforts to address this? And are there best practices from your relationship with the San Diego Housing Commission that you could apply to your processes with the county and Oceanside PHAs?
Thank you for that question. So our numbers might differ a little bit in Howard County because, the VA is in this from the beginning all the way through to making sure that veterans are getting housed. So the process isn't just with getting the voucher, it's actually putting the veteran in a house. And so that's why our numbers look a little different. So we're counting all of those veterans that we're working with because that's a lot of time spent by our caseworkers in order to do that. So our numbers are a little higher than what you may have heard reported. I think were a lot of efficiencies that were at the convention center, congregating everybody there. I think a lot of the wonderful provisions of 4201 that were able to give us ride share, we're able to get veterans to get to medical appointments. So of over 4,400 ride shares, almost half of those were for medical appointments, and 800 of those were for mental health appointments. Okay, so we're getting veterans to their mental health appointments. So that great efficiency that we gained from that. Additionally, we're getting people to employment opportunities and housing appointments as well. I can't also be thankful enough for the increases in per diem that were afforded through there. So with 4201B, we were able to get the increase in per diem. We're very supportive of the efforts to increase that to 200% going forward, as in the budget is being proposed. Those are necessities, and very thankful.
Thank you, Dr. Pearson. Ms. Hines, I want to get your thoughts on this as well with the time we've got. Can you discuss the referral process between VA and the Oceanside PHA and how you're all working together to move veterans into permanent housing more quickly?
So we are starting to work, and we meet on a biweekly basis, on a monthly basis, to talk about referrals, to talk about case management. It has been a slow trickle. I mean, there are months where we get no referrals and months where we get a few referrals. So we're working on that directly with the VA and the staff, I think as a region, through the county's efforts and the framework that they're establishing to look at a region-wide, what are those administrative bottlenecks that are preventing the referrals, and then locally, what do we have going on in Oceanside? Maybe it's an affordability issue that may be preventing those referrals from happening.
Appreciate that. I'm running out of time, but one reason I've heard is, particularly for Oceanside, is veterans might want to live closer to services in the city of San Diego. So I won't ask you to answer because I don't want to hear you get time out. But obviously, we want to make sure those services are making their way to North County. We appreciate it. Now you go back.
That I recognize Ranking Member Takano for 5 minutes.
Thank you. Ms. Albanese, in our discussion about the emergency housing voucher lessons, you were sort of cut off. Do you remember what you were wanting to say about respect to other communities maybe having a greater, so I want to make sure we got that on the record.
Yeah, I would just reiterate that we strongly support utilizing the admin funds that were available for the emergency housing vouchers for HUD-VASH and have that mirror for HUD-VASH. We do know that we have seen nationwide, it has been easier in some instances for those emergency housing vouchers to be used, and it's also been a little bit difficult for HUD-VASH to compete with those in some areas, not everywhere, but in some areas. So if there was a way to make those same benefits and services available for HUD-VASH, it would certainly help.
So what it sounds like to me is we ought to examine how we can redesign
Yes.
or reissue HUD-VASH to more resemble what was done with emergency housing vouchers
Absolutely.
during the pandemic.
I will say that we at the VA have tried to mimic that ourselves using SSVF. It was the best that we could do at the time, but having that attached directly to the HUD-VASH voucher would be better.
Okay, well, that's a big lesson. I thank you for that. I'm glad we got you more time to get that on the record. I want to go to Mr. Wechter. Mr. Wechter, does the homeless court engage with community landlords or housing providers to ensure that those who come through the court are not discriminated against when accessing housing?
So what I can speak to is from the criminal aspect, is from the public defender's office. At our pop-up events, as well as our monthly graduations, we do have representatives from the Legal Aid Society of San Diego that handle the civil legal end of it. So we do have available resources, so when someone does come to a graduation or they do come to one of the pop-up events, they can consult with legal aid to be able to get assistance on those matters.
Well, great. But with regard to making sure that, that these particular veterans aren't discriminated against when accessing housing, is there anything that you're able to do about that?
On the criminal side, no. There would have to be something on the civil side with legal aid, because we have.
That's why you mentioned the legal aid folks
Correct.
being there with them. All right, so that's maybe a separate line of questioning we have, or another witness we have to get here.
Yes.
I've been working on legislation to expand and modernize the HUD-VASH program, and a critical part of that legislation would expand eligibility for HUD-VASH veterans, HUD-VASH to veterans who are transitioning out of incarceration, so that they do not have to experience literal homelessness to be eligible for housing assistance. In many cases, some of these formerly incarcerated don't even have IDs, right? And so, at least for our veterans, we should be doing this for all our formerly incarcerated, but are there additional protections that Congress could consider to make it easier for justice-involved individuals to access housing?
Well, what I can say is that with our new unit, the Pretrial Advocacy Community Connections Unit, we're trying to get in as soon as someone is arrested and developing plans so that when they go through the reentry process, they can get access to a quick ID. We were working with the self-sufficiency services for the county to try and make sure that if they do have local benefits, that we can get them access to that as they're leaving. The problem is with the previously incarcerated, we're either dealing with people that have been in for a while or they're circulating in and out on these lower level crimes. So talking to them and getting them access to those benefits and really just getting their idea about what they have access to is the most important.
And Mr. Chairman, if we think we're having trouble with transitioning service members out of the service, think about veterans who are transitioning out of the justice system and how they fall through the cracks. So that's enough. You think you're having trouble with DOD. Please go ahead.
So we have a very successful program, actually. So we've actually treated or been able to accommodate more than 233 veterans in this program.
Formerly incarcerated.
Absolutely. And so we're actually there's a goal that is set nationally. We're actually at 107% of our goal annually, right at this point already for this year. So we're exceeding what the country is. The national average right now is about 51%, and we're over 107%. So we actually are working with intensive case management and working to get people to homes.
Boy, I would love to learn more about your success, especially as it applies to our veterans who are
Yes.
formerly incarcerated. But we certainly need to find out how we can do this for all formerly incarcerated. So thank you so much. Well, I hope we can follow up with the gentleman, so thanks. I yield back.
Before I introduce Representative Kim, there's also a program, I'm on the Agriculture Committee, and there's a program under SNAP that's specifically designed to help with formerly incarcerated folks getting job training to make sure that they break that cycle of recidivism. So that's something we could try to link together between the Veterans Justice Outreach Program. That's what you're referring to, is that correct, Doctor? Yeah.
Mr. Chairman, I'm glad
Yes.
you did that you're on SNAP, on the Ag Committee on SNAP. There's
Yeah.
so much we need to do with regard to food insecurity
Yeah.
and veterans.
Well, then maybe you should come to Wisconsin and we'll talk there, sir.
I'll be glad to join you and put on a cheese head.
That is now in the congressional record. You all heard it. I now recognize Representative Kim for 5 minutes.
Thank you, Chairman. So the purpose of the hearing is to hear from all of you, the experts who are actually working in this space and actually working with the veterans, homeless veterans specifically. So as we're talking about the best practices here in San Diego County, and on the especially from the Oceanside area where you work with a lot of veterans, I wonder, in part of your best practices in trying to get the support and the resources to them, because at the end of the day, we're all here having this discussion to better serve the veterans so that we can get them out of being homeless into some place that are stable. That's the ultimate goal here. So in that process, how much of your work and effort really involve dialoguing and talking directly with the veterans? So I wanted to know if you can share some of the best practices that have worked really well, but at the same time, can you also talk about some of the initiatives that you found to be less impactful in the process? And I really want to take the information that I'm gathering here today to be able to take it back to my district, which is just next door.
Congresswoman, I can offer for the County of San Diego, as established and has an existing Office of Veteran Services and Affairs that has been a part of our program for many years. And of course, most recently, the Office of Homeless Solutions was created within Health and Human Services Agency specifically for outreach and services and creation of new interventions. And so as a part of that, very much veterans are included with that. And then most importantly, regionally for the entire San Diego County region, the county right now is in a 15-month effort, to create an action plan and blueprint to end veterans homelessness for functional zero. So going along the lines of best practices is very much that regional emphasis and having very specific offices that are charged to provide specific interventions to address the needs of each population in the best way that meets them where they are and provides the needs that they specifically encounter. Thank you.
Ms. Hines, can you talk about, in addition to the first question, but also if there is any initiative that you found to be less impactful?
Sure. So just to add on to the county's efforts, I think all of us as local jurisdictions need to play the part. We've heard a lot about outreach and intervention. I think that that really is the best practice, getting out where our veterans are, where folks are. Oceanside has a strong history of community events, outreach. We house 4 of community resource centers in our more disadvantaged areas. So getting information out to our military community before they're at risk, before they're homeless, to connect them to the right resources, to connect them to the VA. We should be leveraging those touch points, if you will, on a day-to-day. So someone may be coming to a farmer's market, but certainly if that veteran is thinking, a military personnel thinking about and being discharged from the military, having VA, part of the farmers market, part of resource events that we hold, and doing that direct outreach, I think would be beneficial. Because I really think and believe that, again, the theme, prevention and intervention before.
Sure. I would like to ask one last question to Mr. Pearson. When VA hears about, from officials like you from San Diego County about a particular homelessness program that is working really well, do you communicate these successes to stakeholders at other VA regions to try to replicate them and then make sure that all regions are helping our veterans?
Thank you for that question. Yes, we do. We do. So as a medical center director, we have a forum for medical center directors. It also goes up to the network visits, to the Veterans Integrated Service Networks, but also at the case management level. So all the case management, everybody is basically working together in the various communities to share all those best practices.
Well, thank you so much. I will yield back the balance of my time.
Outstanding. Well, thank you very much for coming. The witnesses are now excused, and I do hope you stick around for the second panel so you can get information from them. We'll take a short recess and get set up for the second panel.
Yeah,
Yep.
there's light.
And so
This hearing will reconvene. I'd like to learn how to turn on my microphone. I'd like to welcome the witnesses to our second panel to the table, and I'm please going to ask you to stand and raise your right hand. Do you solemnly swear that the testimony you're about to provide is the truth, the whole truth, and nothing but the truth? Excellent. You may be seated. Thank you. Let the record reflect that the witnesses have answered in the affirmative. It's Angelia. Is that correct?
Angel, sir.
Well, how about that? Mr. Angel? Awesome. You are now recognized for 5 minutes.
We're poor spellers.
Testimony.
Thank you, sir. My name is Greg Angel. I'm here on behalf of Interfaith Community Services. We are a community-based organization serving individuals in need throughout San Diego County, primarily here in North San Diego County. We provide more than 75 different programs, and last year we had the honor of serving 786 veterans in need. I'm here on behalf of the veterans we've served, on behalf of our teams, to share a boots-on-the-ground perspective of what works, what has been proven effective, and what we need to do more of in order to end veteran homelessness here in San Diego and support efforts to end veteran homelessness throughout this country. As I shared in my written testimony, we have decreased homelessness as a nation more than 55%. And the two biggest factors in that have been a significant increase in investment of resources by the federal government and the development of strong partnerships, which we've heard a lot of today and you've seen here locally. That's partnerships between government, community-based organizations, and providers. As has been referenced, the Grant Per Diem Transitional Housing Program has had additional funding that sunsets next week on May 11th. That program, which my organization provides beds here in Oceanside, 64 beds, community-based beds. That program has historically been underfunded, and providers like ours have been hamstringed with what we're able to provide. I want to share some personal experiences of who we're working with so you can understand the level of complexity we're dealing with. I won't detail their experiences. It's more in-depth in the written testimony I provided. But I shared about Mr. Jones, a Vietnam veteran, Marine, who came to Interfaith Community Services after he lost his daughter and his wife within a 1-week period. He attempted suicide and was homeless. I shared about Mr. Martin, a Navy veteran, who was nearly beaten to death in a park while experiencing homelessness. He came to Interfaith with a traumatic brain injury, with memory loss and substance use disorder. I shared about Miss Smith, an Army veteran, who has a long history of abuse and trauma from people close to her in her life and from her military service. Next week, on May 12th, the rate of reimbursement to organizations like my own to help individuals like Mr. Jones, Mr. Martin, and Miss Smith will decrease from a maximum of $152 per day to $64 per day. That amount is not enough to purchase a hotel room in a community like this, let alone provide housing and the care that we were able to successfully provide to the veterans I just described. Mr. Martin has been approved for HUD-VASH, passed his appointment for an interview. He's moving into a new apartment home of his own in the coming weeks. I included additional testimony from Ms. Smith, who is a successful graduate of Veterans Treatment Court, has completed her education, and is committing her career to helping other veterans in crisis. These life-changing improvements are not possible in a community like San Diego, or most communities in this country, for about $60 a day. It doesn't fund the housing that these veterans need. It doesn't provide the case management, the addiction treatment, the mental health, the employment services that are provided. My organization has the opportunity to provide a number of these services in partnership with federal and local government. We provide recuperative care programs for veterans exiting a hospital with recuperative need. I discussed the Grant Per Diem transitional housing programs. We're also providing employment assistance. And then there was talk on the panel earlier about prevention. We provide that as well, funded through private donations, because there is not enough of the existing government resources to provide that. So we strongly support, going back to the transitional housing piece, the Grant Per Diem, passage of acts like H.R. 491, Return Home to Housing Act, or other legislation that can increase the reimbursement for these programs. As we also think about the challenges accessing things like HUD-VASH and other resources, the Grant Per Diem program is a place, it is a safe haven for veterans to go to access a stable home, and for these staff to help these individuals to get into permanent housing. We do need more support. I outlined some other strategies. I will close with the words of one of the individuals I shared, from her words, that she will soldier on. Thank you.
Very well. Thank you, Mr. Angel. It occurred to me that I didn't realize how that was pronounced, and it's apropos that you're representing the Interfaith Community Services. I would now like to recognize Ms. Scrapper for 5 minutes.
Good afternoon to the assembled members of this distinguished committee, and thank you to Congressman Levin for the kind invitation. I'm Hanan Scrapper, Regional Director for PATH San Diego, and it's my great honor to be here on behalf of my organization. PATH is the most impactful homeless service provider in California, serving over 16% of the Golden State's unhoused population. I supervise many programs targeting veterans experiencing homelessness, including Grant Per Diem or GPD, Veterans Affairs Supportive Housing or HUD-VASH, Supportive Services for Veteran Families or SSVF, and the Homeless Veterans Reintegration Program or HVRP. We also operate a Veteran Justice Reentry Program funded through the county, where we pick up each veteran upon their release from custody and ensure they have immediate housing placement while providing the supportive services geared towards preventing reentry. At any given time, we have a little over 400 veterans enrolled in our programs with an average age of 50. Veterans make up about 9% of our unsheltered population and 7% of the shelter population in the San Diego region. On average, there are about 900 individuals who are veterans that experience homelessness each month. As a community, we house about 80 veterans each month on an average inflow of 130. To achieve functional zero, we need to house over 100 veterans each month. San Diego has a strong collaboration with the VA, the Continuum of Care, veteran service providers, and our public housing authorities, which is how we were able to reduce veteran homelessness by 30% last year. However, the high cost of housing in our region makes it challenging for us to find viable, affordable housing for our veteran families. The average income for veterans in our programs is $1,600 per month, and the average cost of a one-bedroom is $2,200. Based on these numbers, we're finding veterans to be rent burdened, which is proven to place these households at high risk of eviction and financial instability. San Diego is one of the pilot communities to launch the Shallow Subsidy program through SSVF. Shallow Subsidy expands housing options and increases the veterans' household's ability to meet other costly living expenses while receiving a fixed rate of rental assistance. This program has been a tremendous help in bridging the gap of housing affordability for veterans who meet the eligibility. This also shows that SSVF is serving veterans with high needs who may not meet eligibility for HUD-VASH. It would be beneficial to consider a multidisciplinary team for SSVF that is geared towards meeting the needs of veterans we serve in this program. We're also very excited to be a grantee for the HUD-VASH program in partnership with the VA in San Diego County. As a lead street outreach provider for the city and county with nearly 70 staff deployed across the region, our goal is to connect every veteran we encounter on the streets to a permanent housing intervention. I wanted to share a veteran family story to demonstrate the level of collaboration that was needed to end their homelessness. I did change their names for protecting their identity. Veteran Angela was experiencing homelessness when she connected with our SSVF program. Angela had an 8% household and was caring for 2 elderly members of the household. Due to their situation, the household was spread across the county. Some were in their vehicles, others were couch surfing. Once Angela and her family were enrolled in our SSVF program, we were able to place them in a hotel with emergency housing assistance. During this process, we connected them to HUD-VASH, and our housing specialist located permanent housing through SSVF while providing application fees, double security deposit, and 5 months of rental subsidy until their HUD-VASH subsidy kicked in. The veteran family is happily housed and stable. Sadly, we know that not every veteran household story ends this way. We need to treat veteran homelessness as a humanitarian crisis, which is why it is imperative that we maintain many of the waivers that were in place during COVID-19 pandemic. Some of the pandemic-era waivers we found to be helpful are expanding the length of rental assistance beyond 9 months for SSVF, expanding eligibility for homeless prevention assistance and shallow subsidy, and increasing providers' flexibility to use hotels for GPD programs for veterans who may be more successful in a non-congregate setting. PATH and fellow providers are a final safety net when all other systems and policies fail. We appreciate the dedication of this committee and this Congress to helping us increase the options available to serving our country's veterans. It was a great honor to be here today. Thank you.
Thank you very much, ma'am. Ms. Scrapper, and along with Mr. Angel's testimony, written statements will be entered to the hearing record. Dr. Potash?
That's correct.
Yes. You're now recognized for 5 minutes to deliver your testimony.
Thank you so much. Good afternoon, members of this committee and fellow providers. I'm honored to be here on behalf of AJOIN. My name is Dr. Dustin Potash, and I have the honor and privilege of serving as the Veterans Director for AJOIN. I oversee multiple programs, including the SSVF and shallow subsidy programs. With nearly 12 years of work in this sector, our organization is built upon the Housing First model, ensuring the goal of low barriers to entry for those in need. San Diego has seen a reduction in veteran homelessness through the use of the SSVF and shallow subsidy programs. These reduced numbers have only come because of the continued efforts made by service providers, Congress, and local partners in the use of the Housing First model. This model ensures that those veterans who may have mental health needs due to PTSD from events during their time in the military have permanent housing to better address their needs. Many of our clients come in with high barriers that make it very difficult for them to be housed. We would encourage this committee to continue the landlord incentive program so that we can continue to offer more options. This time I'd like to share a story of one of our clients. The names have been changed. Emily is an Air Force veteran who received an honorable discharge. When she came into the program, she was living in an abandoned RV that had no running water or electricity. She had been asked to leave the RV as it was parked on someone's property. Emily was a registered nurse, but at the time she came to the program, her nursing license was suspended. Emily had a service connection compensation of $1,100 per month from the VA. At the time of enrollment, Emily's money was spent on paying for drug testing as required by the licensing board as part of her efforts to reinstate her license. Most of the time, Emily was left with no money for other needs. Emily was in high crisis mode when she reached out to be enrolled in the SSVF program, and it was often challenging to engage with her. Emily was consistently stressed due to not having the place to live and no money to cover basic needs. Emily was estranged from her friends and family due to her constantly asking them for money to sustain her needs. With the assistance of an SSVF housing coordinator, Emily found a unit that she liked and we helped her move in. Emily continued to work on completing all requirements with licensing board, and after being housed, she was able to apply for CalFresh assistance and was approved. With the assistance of the AJOIN with rent payments and utility, Emily was able to concentrate on getting her nursing license reinstated. Emily is now a full-time nurse at a local hospital making $36 an hour. Her license was reinstated in January of 2022. Emily has since moved into our shallow subsidy program, where she has been very successful. We appreciate the dedication of this committee and this Congress for helping to find more solutions to end veterans' homelessness, like Emily. I do believe, however, there is still a gap in our system when it comes to a service member transitioning from the military to civilian life. When talking to many of our clients, many of them state that they were rushed out of the military with no plan in place, which played a role in them becoming homeless. Since my separation from the military, I know this committee in Congress has implemented the Transition Assistance Program to help service members with resources, classes, and training, but I believe it needs to go a step further. It is my belief that service members should already have a job, permanent housing, and VA disability income, if applicable, all secured before leaving the military. I don't know whose responsibility that falls onto, the military or the community. One possible solution is to allow providers and grantees to be a part of that transition process on military installations. I believe this type of collaboration would drastically reduce the number of homeless veterans, not just here in San Diego County, but nationwide. The rental rates here in San Diego are high, and the available housing is low, which is another barrier for our clients. A possible solution would be to allow SSVF and shallow subsidy providers to turn rundown hotels and motels into permanent housing units. Case management and wraparound services would be available on site to address needs. Ending veteran homelessness can be achieved with out-of-the-box thinking and working as a collaborative. It was an honor and privilege to testify in front of you at this committee about the SSVF programs, shallow subsidy programs, and some possible solutions to better protect those veterans who served us. I look forward to answering your questions. Thank you.
Thank you, Dr. Potash. The written statement of Dr. Potash will be entered into the hearing record. Mr. Spear, you are now recognized for 5 minutes.
Okay. Good afternoon, Chairman Van Orden and Ranking Member Levin. My name is Sean Spear. I'm a President and CEO of Community Housing Works. I first want to thank you for holding this hearing today and giving each of us the opportunity to share our perspectives and ideas with you. As mentioned earlier, Community Housing Works is a nonprofit affordable housing developer and owner. We also provide services to our residents as well. We're a nationally recognized organization that's been around for 35 years, serving the greater San Diego County, although we have properties in 8 other counties scattered throughout California, as well as property in Texas. We emphasize providing affordable housing for working families, seniors, and those with special needs, including veterans and other people who may have recently experienced homelessness. CHW believes that opportunity begins with a stable home and providing a place that translates to a sense of pride of self, and that spirit of hope leads to the realization of dreams. Today, CHW owns more than 4,000 life-changing apartment homes across the state, as well as in Texas, as I mentioned earlier, our services themselves emphasize the notions of providing better outcomes to our residents once they've moved into our developments. So our services themselves focus on education outcomes from K through 5 all the way through those graduating high school and going on to college or to other certificate programs. We also provide financial sustainability and well-being programs, and also health and well-being programs, primarily geared towards seniors and those in special needs. Our informal motto is we build futures. And that emphasizes that we don't just provide a roof over people's heads, but that we also help them achieve their dreams of a better future for themselves and their loved ones. We at CHW pride ourselves on serving people of many different backgrounds, including our community's honored veterans who have done so much for us. We currently have dedicated veteran units in 4 of our housing communities, with additional self-identified veterans living within 2 other CHW supportive housing communities that are utilizing our partner-provided case management services. Whether it's from our own staff in terms of providing the services or from third-party partners, a few of which are at this table with me, as well as partnerships with the Veterans Administration more recently. The emphasis is really on providing resident services that are freely offered to these residents with the goal of helping them develop a sense of belonging, camaraderie, and pride for one another and their community. For our veterans specifically, this work could not be done without the strong partnership that we've recently forged with the VA, as well as other local HUD-supported public housing authorities. I want to emphasize that while we have built positive and lasting relationships with our local VA offices while utilizing the HUD Veterans Affairs Supportive Housing Program, or VASP for short, we believe that there are administrative steps that Congress could facilitate to have this program support the creation of even more veteran-serving affordable housing, as well as get vulnerable veterans into those units more quickly. In my written statement shared with you earlier, I provided some detail on a set of challenges and suggested solutions centering around, 1, reducing the time lag between when new units are ready and when VASH-supported veterans are able to move into those units. 2nd, the unfortunate disqualification of many needy veterans from being able to occupy those units based upon their disability benefits and how those are treated in their income eligibility certification process. And thirdly, a set of real estate-related measures that could attract more private capital to potentially generating thousands of new veteran-serving affordable housing units and supportive housing units nationwide. Authority to project-base more voucher rental subsidies within a given community, more co-location of housing on VA-controlled land, expanded use of the existing funding authorized under the 2022 PACT Act, and other key reforms that have been spelled out for the housing tax credit program would be potentially cost-neutral changes that could ultimately spur more of those units for more veterans. If time permits, as we go forward, I'm hoping to elaborate on some of those ideas as well. So just quickly to say that, we really appreciate the opportunity to come before you, to share our ideas, and also hopefully discuss some solutions as we go forward. Thank you.
Thank you, Mr. Spear. Mr. Spear's written statement will now be entered into the record. We'll proceed to questioning, and I recognize myself for 5 minutes. I got to tell you, housing is really hard. I live in rural Wisconsin, and we have a similar problem that you do here in San Diego. You call it the Pacific Ocean, I call it the Mississippi River. So you just can't go that way any farther. And how it affects me in Wisconsin's 3rd district is that we have a real issue housing migrant agricultural labor, and it's the same story. But that's for another committee. We're here talking about veterans. I didn't see in anybody's testimony the public-private funding breakdown, comparison between like 2020 and 2023. So, Mr. Angel, you referred to this, that your donations have kind of not there so much anymore. What is the ratio between, in 2020, private donations, federal government money?
In 2020, the community was very generous in response to COVID. Private donations made up about a third of our revenue that year.
Okay.
For this year, it will make up closer to 15 to 20%. And I also spoke in my written testimony to our private intervention is simply not scalable to the level of the need.
Yep, I get you. Ms. Grapper?
Generally, for San Diego, we rely heavily on federal, local funding, city and state. So about 10% of our operating budget would be maybe privately donated or foundations and such.
That's consistent from 2020, 2019 to 2023?
Correct. A little spike in the pandemic during 2020 because people did respond generously.
Okay. I'm going to skip you for a sec, sir. I'm going to go to Mr. Spear. So you were quick on that microphone.
Sorry, so we're a little bit of a different animal. As a affordable housing developer,
Right.
we have our primarily use both a combination of developer fee that's allowed under some of the programs that we use, as well as some amount of rental revenue that comes off of after payment of debt service on properties. And then we will fundraise for usually our resident services.
Okay,
So
so
generally
if
it's
you're-
about a third in each of those cases.
Has there been a change in that between 2020
We have
or
seen
2019 and now?
some challenges during COVID in terms of our fundraising work for our resident services. That has rebounded a bit, but we still have a target. Essentially, the kind of profit that we get off of the developer fee and off of the rental,
Yeah.
we then turn back into services.
I
And
just-
we've
I've-
had to put more into the services.
My
So-
concern is this, and I expressed this while I was running for office, is that a lot of people unfortunately folded some of these funds, these emergency funds, into essentially programmatics, and they started depending on them, knowing full well that they were going to sunset. So we got to figure out a way to continue to provide the services that we have. And thank you for being very honest with that. Okay, Dr. Potash, me. That is the answer to your question, me. I am responsible for the Transition Assistance Program as the chairman of this subcommittee. So when this is not going right, it's my fault. And I've been in Congress for 111 days or something like that, so I'm working on it. But I also want you to know that these are the problems that keep me up at night. Like, how did Emily go from being an RN to living in a mobile home or a RV without electricity? Because again, that didn't just happen. You had a productive person working, I'm assuming at the time, as a registered nurse because she lost her license. How did she go from there to here? Do you know the answer to that question? I'm asking you.
No, that's a big question, right? And I think it goes back to before she even left the military, right? Addressing any type of needs that she may have, either mental health, substance abuse, the whole gamut. Someone actually needs to do a hand-holding process for these service members because a lot of them don't have plans.
Yeah.
And they're being rushed out of the military.
Yep. I want to find the answer to that question because, again, we have to start doing upstream solutions.
Yes, sir.
And the only way we're ever going to do that is if we really meticulously look at how did the person get there to begin with. Thank you very much
You're welcome.
for that. I appreciate it. With that, I yield back. I now recognize Ranking Member 11 for 5 minutes to question the witnesses.
I thank the chairman again, and I thank all of you for being with us and for all the great work that you do. And Mr. Angel in particular, I want to thank you and the work Interfaith does. You'd mentioned that the higher per diem reimbursement rate for providers who operate GPD transitional housing is set to significantly decrease in 1 week. And you also discussed how that's going to impact your ability to provide services and resources for veterans under your care. And I strongly support fixing this, and I hope that we can work on a bipartisan basis to figure this out. But short of congressional action, what is your plan in the near term? How are you going to, as you said, soldier on?
Well, Chair Van Orden, as you described, many organizations received emergency one-time support that was built into ongoing programming. We did not. So we used the one-time support to provide one-time additional assistance to the veterans we were working with. What that means, though, is that we were not able to provide wage increases that we would like to our master's educated case managers, to our licensed behavioral health specialists providing mental health services, to the addiction treatment specialists doing this work. So we're working to secure additional revenue sources, particularly public-private partnerships with healthcare, to bring forward additional revenues to increase those salaries so that we can bring on credentialed workers to do this. Also increasing peer engagement specialists with lived homeless experience. And we will rely upon the generosity of this community to support that work and do the best that we can.
Well, you have my commitment, being very knowledgeable about the work that you do, that our office will do whatever we can to assist in that regard. Ms. Scrapper, I was really pleased to hear PATH is now providing services for veterans residing in permanent housing in the HUD-VASH program. I've been exploring tweaks to modernize the HUD-VASH program, including expanding eligibility to veterans with less acute needs than those historically served. Given the significant number of unused HUD-VASH vouchers across the country and here in San Diego, the hope would be to allow more veterans who just need the vouchers to utilize them, while ensuring case management is retained for veterans who need that support. Could you discuss how that might affect allocation of case management resources for the veterans who require the most intensive services?
Thank you, Congressman. I think if we're thinking about having HUD-VASH vouchers for veterans who may not need the case management component, I would worry about losing the much-needed vouchers for those who truly need case management, unless we're thinking about increasing that utilization or the number of vouchers that would come into the community. This would absolutely bridge the gap in housing affordability that we're talking about, because veterans may not need that long-term, high-need case management, but they're still at high risk of recidivism and continuously being in the cycle of homelessness if they're not in a housing stable situation. And so I would say, first, we need to fix our utilization rate so that we are getting more referrals and veterans into housing, and also looking at the inflow and preventing homelessness from occurring to begin with. And then also utilizing basic Section 8 that could be considered HUD-VASH that for veterans who need that long-term subsidy without case management.
Thank you for that answer, for the work that you do. Mr. Spear, I'll turn to you. I appreciated you sharing how Community Housing Works uses the project-based HUD-VASH voucher allocations to develop permanent supportive housing for veterans. And I think you heard the commentary on our first panel with our government witnesses about the slow uptake of these sorts of projects in our region. Do you have any comments you'd like to share in response to that discussion? How should public agencies be working with organizations like yours, and how can we improve these numbers?
Yeah, I think the biggest thing is the notion of the availability of it. And, you know, there is a process for being able to dedicate a certain number of units to serving veterans through the VASH program. Certainly you would want to have more bang for the buck by being able to kind of lift that cap that was spoken to earlier about the notion of no more than 10 units or no more than 10% of a given development. This is a resource that, when used properly, then can leverage an additional amount of private capital to come to the deal. By having the rent revenue and the FMRs that get set, for instance, by like Oceanside, and having that become the basis for the rent that then can attract more debt to the project, that means less public resources that need to be done in order to do that affordable housing development. It's a win-win in terms of being able to not only have additional veterans served, but also be able to leverage valuable public resources for more private capital.
Thank you so much for all the work you're doing. I'm out of time, but greatly appreciate your all being with us. Look forward to working with you in the months and years ahead.
Thank you.
And I'll yield back.
I want to thank everybody for coming out today, and to have me back in California, even though I'd much rather be in Wisconsin, let's be honest. I love it there. You guys come visit, you'll see. I'll give you cheese and your choice of malt beverage. Hey, listen, no veteran should be going unhoused. We just shouldn't. And some of my veteran brothers and sisters, unfortunately, wind up in that situation. And I want to thank you, Mr. Levin, for having us here. I really do appreciate it, and I appreciate your openness and your candor and the fact that I truly believe that you care about what we're dealing with and that you truly understand that sometimes we're not going to agree on everything, but I guarantee if we keep these people and our veterans on the forefront of our minds that we're going to come to an equitable solution. So thank you very much for that. We're going to get back to D.C. and we're going to go to work. That's what I came here to get tasked by you. And I'm going to get down and I'm going to sit down, as I said, with Ranking Member Levin here and come up with some solutions that are the best for the most amount of people we possibly can come up with, because that's what we've been tasked to do by you folks here. That's what we tasked Mike with, and back in the 3rd, that's what they tasked me to do. So I'll tell you what, I've learned several different things that were disconcerting during your testimony. And again, a lot of these problems keep me up at night. And I'm a retired senior enlisted man, which means the rubber will meet the road. There's a lot of time for talk. There's time for some action. So with that said, I'd like to yield back to Ranking Member Levin for any concluding remarks you might have.
Well, I just want to thank the chairman again for joining us today, and I want to thank all of our witnesses on the first panel and the second for representing our community really, really well. I'm so grateful for the leadership that you show and the collaboration that you employ in your duties to serve our veteran community. And it's really an honor to get to work with all of you in your responsibilities. And I will also take back to Washington, D.C. that sense of camaraderie and that sense of collaboration, because I think it's sorely lacking in Washington, D.C. I really want to thank the staff as well, both majority and minority, for working together in a spirit of collaboration, as well as has been the case for the last number of years on the committee. And I look forward to going to Wisconsin. I am ready, and I'm also ready to take you to one of the great craft breweries in North County, San Diego, after this hearing. And with that, I'll yield back. Thank you.
Thank you, Ranking Member Levin. And again, thank you all again for participating in today's hearings. I ask unanimous consent that all members may have 5 legislative days to revise and extend their remarks and include extraneous materials. And I ask unanimous consent to enter into the record a statement from the San Diego Regional Housing Commission. Without objection, so ordered. This hearing stands adjourned.